Nursing is one of the fastest growing healthcare jobs. There are hundreds of fields that a nurse can go into, whether it's pediatric in a hospital, doctor's office, an oncology specialist, a geriatric nurse, or even a rheumatologist nurse. The list goes on and on. Out of all the fields of nursing there are, today I'm going to talk to you about 3 of them. I'm going to be talking to you about a registered nurse, nurse anesthetist, and a nurse practitioner. Nursing is a very rewarding career. Whether a nurse is delivering a baby, helping a life-saving surgery, or simply giving a patient fluids. Nurses help with numerous amounts of things on a daily basis, and that feeling of helping is unlike any other. A basic registered nurse is working anywhere within the healthcare field. This can be in a hospital, doctor's office, school, or a clinic. This is as simple as nursing gets. This is what every nurse you ever encounter has to be. A registered nurse has a lot of responsibilities on a daily basis. Some of these responsibilities include monitoring, recording, and reporting systems or changes in patients' conditions, maintain accurate, detailed reports and records, take and record patients' vital signs and medical information, order and evaluate diagnostic tests, modify patient treatment plans depending on the patient's response and condition, consult and coordinate with other healthcare members to assess the plan and evaluate the patient care plans. And that was according from ONET. In 2008, the number of registered nurses in Ohio was 119,000. In 2018, the number is expected to increase 18% to 139,000. The United States as a whole had in 2010 over 2 million registered nurses, and in 2020 expect that number to increase 26% to 3.5 million. The median yearly starting salary in the United States for a registered nurse is $66,000 a year, according to Infonet. A second field of nursing I'm going to talk about today is a nurse anesthetist. A nurse anesthetist is a nurse of anesthesiology. This is a very crucial job. Most nurse anesthetists are in surgery all day. A nurse anesthetist is in surgery the entire surgery while the doctor of anesthesiology gets the OB started and leaves to see other patients. A nurse anesthetist has a lot of jobs during their day. These jobs include managing patients' airway or pulmonary status using special techniques like mechanical ventilation, pharmacological support, respiratory therapy, and extubulation. Assess the patient's medical histories to predict anesthesia response, prepare prescribed solutions and administer local, spinal, or other anesthetics, and administer the emergency anesthetics. And that was according from ONET. This is just a small list of what a nurse anesthetist does. This is a very important job and requires extra schooling just because of how important their job is, basically to keep the patient alive while they're in surgery. In Ohio, the employment of nurse anesthetists in 2010 was 100,000. In 2018, that number is expected to increase 18% to about 118,000. In the United States in 2010, there was a total of 1.2 million nurse anesthetists. The median starting salary for a nurse anesthetist is $80,000 according to Career Infonet. The final field I'm going to talk about is a nurse practitioner. A nurse practitioner is a step down from a doctor. It's basically like a watered-down doctor with less schooling. A nurse practitioner can work in a hospital, see patients, work at a clinic, and prescribe medicine. The way things are going these days, nurse practitioners are going to be the ones seeing patients now instead of doctors just because they have to pay doctors too much. On a daily basis, a nurse practitioner has numerous amounts of responsibilities. These include prescribing medication based on a patient's characteristics, interpret the results of diagnostic tests such as complete blood counts, electrocardiograms, x-rays, analyze and interpret patients' histories, symptoms, physical findings, or diagnostic information to help develop appropriate diagnosis, develop treatment plans, standards of care, and professional practice guidelines, diagnose or treat acute healthcare problems, prescribe medications based on efficiency, safety, and cost as legally authorized, and consult patients about drug regimens. That was according to ONET. A nurse practitioner is responsible for deciding what is going on with the patient and how to make it better. In Ohio, in 2010, there were 90,000 nurse practitioners. In the United States as a whole, there are 1.1 nurse practitioners. These numbers are expected to increase about 20 to 26% within the next 8 to 10 years. The median median starting wage for a nurse practitioner in the United States was $96,000, according to Career Infonet. In conclusion, today you have learned about 3 fields of nursing, what their job entails, how many of that specific nurse there are, and their average yearly salaries. Each field requires more schooling because they are required to know information, therefore they result in yearly wages. Nursing is a very interesting field to get into, and I hope that you all consider nursing as a field if you're not quite sure what you want to do, or just appreciate the nurses you encounter more.